Hyperbaric Oxygen Therapy is a safe and highly effective treatment where the air pressure is increased to 3 times higher than normal. This allows your entire body to gather more oxygen than normal, with a focus on healing wounds and infections by improving circulation and stimulating the growth of new blood vessels. I met with Dr. Alan Kimmel, the medical director of hyperbaric medicine at GBMC, to learn more about this technology and how it's used to treat diabetic patients. Why is hyperbaric medicine used to treat diabetes, and how is it used?
So hyperbaric medicine has been around for 100 years or more, and it goes on the principle that every part of the body can get injured, gets a wound, gets a sore, gets a little laceration or a fracture, and our body strives to heal ourselves. That's what we do. And diabetics get small, tiny wounds, but there is a big segment of that population where those wounds don't heal. They fester, they develop worsened circulatory problems, sometimes even leading to amputations.
Right, I've heard that.
The main reason why that whole cascading sequence of events occurs is that we can't get all those healing cells and the oxygen and the blood flow to the damaged tissue because of the damage from the diabetes. Hyperbaric pushes oxygen right into the tissues and bypasses those weakened and damaged capillaries. That oxygen penetrates right past the blood vessels and right into the tissues. So damaged areas such as a diabetic has can now suddenly get the supplies they need to start to rebuild. And that's how hyperbaric oxygen works.
Are we talking an instant heal, a cure right away?
Well, it takes a while. So the typical hyperbaric experience for a diabetic might be 30 or 40 treatments, and suddenly the wounds really start to show that they're healing.
Are there any side effects?
So, any therapy like this could have side effects, but there are folks who can get claustrophobia. The other common side effect is ear pressure.
Is it always a whole tube experience? Wouldn't you have little chambers for the legs, little chambers for the arm, and not have to do the whole body?
So those things have been tried, and we find it humorous that some sports figures use things like that. They've been shown not to be effective. You really have to get the whole body into the chamber. This is much easier. It's much more, it's set up for an individual patient. Being trapped in the tube is certainly an initial concern of patients, but as nurse manager Dana Maniuszko explains, the highly trained staff never leaves your side. Okay, so tell me what a normal patient would see upon first coming into this room.
All right, so the patient usually gets changed in the change rooms we have back in there. They put their gowns on, and then we would assign them a chamber. So they'll come over here to the stretcher, hop up onto the stretcher, get comfortable. Every patient gets a grounding cable, and this is connected to the stretcher. They wear a little bracelet on their arm, and we put this on because if you have any residual static left on your body, it'll get discharged before you go into the chamber.
No kidding. All right, so the patient's comfortable now.
Yep, the patient's comfortable. They get a bottle of water they can sip in the chamber with them. So we have a treatment safety record, and this is extremely important because, again, safety is, we don't want to fire. Once we've done the safety treatment record, slide the patient in the chamber, show you, put the thing up here, and in they go. Just like that. Stretcher slides out. Any last words? And then we close the door. Once the chamber's on, they're ready to go.
How often do you get somebody saying,
That does happen, but we can stay in communication with our patient.
Okay. So once you've got them in there and you've got them comfortable, do you stay here? Do you go on to another patient? Did you move
We
around?
never move from our spot. So once the patient, that's your patient, you're assigned that patient, there's one-to-one communication and one-to-one, your eyes have to be on that patient at all times.
What do patients say when they come out, especially after the first time?
So it can vary from no piece of cake all the way to I was terrified the entire time.
And relief when you come out.
And much relief, and I will be here tomorrow as long as you're here with me kind of thing. So.
But enough with all the talking. It's time to see what this treatment and tube are really like.
All right. Blanket.
I'll be all right.
Okay. All right, you comfy?
Yep.
Good. Okay, what I want you to do is cross your arms across your chest so we don't catch your elbows on the way in, all right?
It's kind of like a casket pose, isn't it?
Yep. Head up, elbows out.
Ooh, the glass is close, isn't it?
It sure is. All right, so.
Yeah, it's sounding really good in here.
Any last words?
Goodbye.
Have a great treatment.
Thank you. I'm not sure she had to slide the door.
You okay?
Yep.
Okay, you can hear everything? Okay.
Yep, I can.
All right. You can watch your TV. Look.
I'm just gonna let them shoot around and things here. It's interesting. Much better than an MRI. All in all, a very doable experience, especially when you know it's going to help you heal. For Greater Living, I'm Don Scott, inside the hyperbaric chamber at the Greater Baltimore Medical Center.